Hello, everyone. Welcome to Insight Tuesday. I'm going to start Insight Tuesday in about a minute. Come into the room. And for those that are already in the room, the purpose of Insight Tuesday is to go over a RHIA concept or RHIA thing to help you and support you as you're preparing to take the RHIA exam. Now, once again, this is not going to be my entire course. If you are looking for something a lot more comprehensive with a lot more information, a lot more details, kind of everything versus a little nugget, then I highly recommend you checking out my RHIA courses. They're on demand. I also have study guides and other cool things at my website, www.rhiaessential.com. So if you haven't been there before, the link is in the description. So go ahead and check it out if you would like to do so. But I am at 1 minute. So I'm going to go ahead and start. And today's topic is going to be on something that is a very big piece of health IT when it comes to the hospital space. And it's also a very critical thing to understand when you're trying to take your RHIA as well as your RHIT. This information can be found or tested within domain 1 and sometimes domain 2, believe it or not, and even some aspects of domain 4. So this concept can be found in several areas of the RHIA and the RHIT exam. So I'm going to go ahead and share my screen. We're not going to be here forever. Like I said, these are little nuggets of time together to go over things. We are going to talk about improvement. And this is a wide depth of information that we can cover. I wanted to tackle some of the important terminology that you want to understand and have a good grasp on when you're wanting to be successful on the RHIA and or the RHIT exam. So I'm going to cover some concepts. I'm going to talk through them. If you have any questions along the way, feel free to let me know in the chat and I'll stop and answer your questions. And we're just going to go through this grid. So I'm going to go ahead and maneuver over to the next slide. And let's first off talk about what clinical documentation improvement is. This is a process that is found in hospitals and medical facilities that is there to ensure that there is accurate and complete patient documentation through identification of documentation deficiencies. So how this whole process works is that you would have a health IT professional, an HIM member of the team, whose job it is to look through documentation that is completed by the provider. And they're going to notice, hopefully, through their evaluation of any deficiencies that may be present. And it's the job of this individual. They can be called a CDI specialist. There's a lot of terms used in the medical field, but whatever term that they are titled at that facility, they would be responsible for connecting with that provider and validating and trying to get a better understanding of whatever they may have noticed from that documentation. This conversation and this request that they may send over to a provider to get clarity about information is called, the definition that's next on the list, a physician query. And this is defined as a written request to a physician to clarify or complete the information in clinical documentation to ensure that there is accurate health records. Sometimes, in some cases, they may have a patient whose medical record shows that they are coming in for 3 or 4 things. However, the medical information or the notes put in by the provider doesn't seem to match the actual ICD-10 codes or the CPT codes that were actually put in. So in these cases, just as one example, you may find that that HIM professional, that CDI specialist, would then need to reach out and get clarification of what the physician meant. So those are called physician queries. And that is something that is tested quite a bit on the RHIA, understanding what it is and the importance of doing that, and also the right way to do that. So you want to understand all of that for the exam. So clinical documentation improvement is the process of ensuring that there's accurate and complete patient documentation to help with, of course, reimbursement and healthy care for your patients. The CDI specialists are able to validate anything that they question through a process called a physician query, right? It can be written, they can walk up to the provider, it just depends on the facility. And I wanted to now cover some other terms. So the next term I wanted to cover that relates to CDI is something called computer assisted coding, or a CAC. What is a CAC? A CAC is an application that uses natural language processing, or NLP, to scan medical documentation in the electronic health record. It helps to identify key terminology, and it also will generate code recommendations. So a CAC is used in healthcare facilities to assist when it comes to CPTs and assigning ICD-10 codes. So it's just a helper, just a nice electronic assistant that will be able to read the medical note that was typed out or written out by that provider or that medical professional, and they'll be able to hopefully spit out some codes that it feels matches what they actually see in the note. Just a heads up for those that may be here that are coders, these are not here to take jobs away, right? A computer is not going to know that Dr. M normally makes a mistake and actually meant to put this code instead of that code. That human touch cannot be given in these systems. So that's why the coders are still needed even with all of this technology, okay? So that's what a CAC system is. It's there to assist by reading a note and being able to identify key terminology and provide recommendations, which may or may not be taken by the user. Now, what is a encoder? Because people tend to get encoder and CAC mixed up. So I wanted to clarify that today. A encoder actually uses web-based software instead of code books. So normally, right, you have your coder in the medical facility, they're ready to code for a set of files, and they would be able to use their CPT books, their ICD-10 books, and they'll be flipping through trying to find the right codes to assign for that visit. To replace the use of these code books, there is something called an encoder, which is the same thing. It has the same resources. It shows guidelines. It shows commonly used codes. It shows all this information, but it's going to be stored in a web-based software versus someone having to use the physical book. So that is the difference between an encoder versus, just having that physical book at hand. So people often get encoder and computer assisted coding mixed up. The differences between the two, as you can tell, is that the computer assisted coding is going to actually do the work of scanning the actual note and then generating recommendations. Encoders won't do that all the time. They're pretty much there to kind of just give you the guidelines and lead you to what's available versus having the physical book. So there is a difference between the two. So the next term that I want to cover that relates to CDI is something that a medical facility, a hospital, should be doing at least twice a year. And that is something called an audit. Why are audits important to do? because when you do an audit, you're able to identify if there are any patterns or practices happening within your facility that may be causing your providers to not get paid correctly. You may be overcharging patients, right? There are a lot of things that could be happening, but you're not going to identify these things unless you perform something called an audit. So the audit process is going to be where you have someone that is not going to be in your facility. So someone externally, some specialist, consultant, someone not from your practice that could be biased, right? You want someone that's not going to be affected by the results to come in and review the patient records. And it should be at random. They shouldn't be given every single medical record ever done. That would take forever to audit. You will give them just random dates, just random files, and they will look through it and assess if things are actually accurate. Like, are the actual codes that were used the correct ones? What improvements could have been done? And from these auditing or audits, you're able to identify ways to help better improve things at the facility. You may do an audit and realize that we need to retrain our staff on how to do X or on how to do Z. All of this happens in the auditing process. So you want to know, as a test taker for your RHIA or RHIT, the importance of auditing and why it happened. So hopefully you get it now. If you don't, let me know in the chat, but it helps with quite a bit of things for the facility. And the last term that I wanted to talk about was benchmarking. And benchmarking, which is a very popular word on this exam, RHIT and RHIA, is connected with the auditing process. When you're trying to review these records, or when the consultant is reviewing these records and trying to assess accuracy, they need to know what standard that you're trying to meet up with. So maybe your benchmark is that the accuracy levels are at 90%. You need to have some type of standard that you're either trying to meet or trying to exceed when it comes to doing an audit. And the terminology for that, for establishing those criterias, is classified as benchmarking. And benchmarking can be determined by looking at your competitors, right? Looking at what other people are doing. It could be determined by looking at what the organizations or what the industry standards are. Could also help you identify what your benchmark is going to be. But whatever that benchmark is, you need to have that in order to have a effective auditing process. So all of these words, all of these terms are related to CDI. And I want you guys to watch this and understand these words, understand how they all work together, because these are easy questions that I don't want you guys to miss on test day. So I will wait a few seconds here because I'm almost out of time. Does anyone have any questions for me about anything related to CDI that I've covered today? Any questions at all before we end today's Insight Tuesday? And I'll give it just a few seconds for anyone that may have a question. If you do, feel free to use the chat and I'll be more than happy to answer. Any questions? Going once. Going twice. Okay, I'm seeing no questions. So I'm going to take that as a no. All right. So in that case, like I mentioned before, if you want to learn a whole lot more about what to expect on your RHIA or on your RHIA exam, feel free to check out www.RHIAessential.com. And if you are not looking for a course, that is perfectly fine as well. I will be here every Tuesday for Insight Tuesday. So join me next week to just gain some nuggets here with me. And if there are no questions, I will see you guys next week for another Insight Tuesday and another topic. All right. Bye, everyone. And thank you for watching. Bye.